My name is Gaga from Integrated Disabled Women Activities, working as the Gender and Advocacy Officer. I'm here in Kaliro to shoot a documentary in line with access to inclusive services for women and girls with disabilities in Kaliro District.
Amaina gange nizo namugabwe Teddy hero sibukere uhami egombolola Budomero District Kaliro hinkola ngo palaligo mshitongole shahidiwa nzo kutyobola ibuwango kuntyobola okunkako mukwano eyategeire nga nsunisirya kidda nanchawa ngampyata kubupyati ngano no ndagiriza omuntu tawulirise byemba mutumire ngano wenkube isimu angwa kukunzuma iwa kaleme iwe nze tinsobola kubana iwe nimbona nga kiri kunkosya mutima gwange ena zaire nze tinzala na muleme nze nzala na bantu balamu era iwe ina bayibawa abandi owenzala na iwe muleme obwongo buba obwa mwana buleme ate no mwana mba muleme wena no bango oli muleme kale tinsobola kuzala na iwe bulecho yambo omuntu obulankulankula nejo ojo sobola okulankulanya omuntu nagezerieko sino buyambi bona herie polisi hoa muno madamu alieti kubanga twatyaimo musongo otini jejo o madamu alieti natumula no oibuwange natandika okumpa buyambi natandika okutumula nanze nokundago mukwano amagezi nza gembawa abakyala baliko obukosefu n'abaana baliko obukosefu osuna obuzibu olina okwaba kwerose okweripotinga okwaba okugenda abakyala okwaba okubigombolola ebiba bikulemera awo ng'oyaba probation niga agamagezi gensobola obawa.
Nze Harriet nsinzire bwaya Kasoko sub county Kaliro District ndi beneficiary mu idua naba paralego ate naba peer educator mu kitongole kino embera y'okutulugunya abakyala n'abawala abali ku obulemu mu Kaliro District eri wangulu ino lwakuba oyagana abawala abali ku obukosefu okutulugunya kutandikira ddala waka wayagana omuwala nga tebamutwalire ku isomero lwakuba ali kuki obukosefu abandi babakweka inyuma w'amayumba abandi babata mu mafumbiro ye babasuza wayagana okutulugunya okwo wetwira mu bakyala omukyala ali ku obulemu ku mubiri azira kyasalawo waka buli kintu kiba kya musaada katukobe balimye tajagemaku bagana obuzibu bwe bafuna tibasobola kweyogera n'ekisooka wayagana nti bamutulugunya aye ng'azira wakutandikira azira wakujja yaba ng'asigalawo ng'ali mu bokisi lwakuba azira kwamugemaku obundi wayagana naddala mu bakyala abali ku obukosefu abafumbe nga bwenkobye inyuma wali bazira iroboozi iroboozi kintu kikulu tibaidi rights daiwe ate omuntu wabanga taidi right kizibu ino okufuna obwenkanya ensonga eyindi abakyala abali ku obukosefu n'abawala abali ku obukosefu bwe bajja ku poliisi babasaba naddala sente d'amafuta ati sente okuwandiika wabona ng'omuntu obuyambi bw'agira okufuna talikola ki tali kubufuna challenge eyindi yaba nti we bajja mu malwaliro babakoba ati mewena wali otya okuzaala bagana we tujja mu masomero bano abaana abali ku obukosefu wabanga yeekulula bamusindikira inyuma eyo wayagana nti n'omusomesa azira help yawaire ki mwana oyo eriyo bano ba defu omuzaire ng'azira sente ditwala mwana mu private school like Bakire akati kamutwalenga kwano ku Kyanfuba primary school wayagana ng'oyo oyazira kye bamwamba kuwaire n'akalala kale obuzibu bwabanga buki bunene gaano nga nze paralego kye nandisabye tukole sensitization omuntu ategeere agwawa ategeere right side nediriwa kubanga omuntu wana ategeera right side nedo violence didakola ki didakuwaawa omuntu alida kuba ategeera nti wano we bankosa nemukira wano advise yempa abakyala abo oba abawala abali kutulugunyizibwa nti ni kesi we bawulira kwaka olukiiko lona nga lugema ku bawala abali ku obukosefu oba abakyala nga ligema ku idembe lyaibwe babeegeme wafuna ekizibu alumuke atuuke eyo twida kubayamba ni poliisi alumuke eyo oba ku probation oba ku erosi balida kuyambibwa okusinga okuba einuma w'amafumbiro beetanire ino okukola obukosefu titukoba nti obukosefu tibuteesobola.
I'm Jumire Nelson, the Senior Probation and Social Welfare Officer of Kaliro District. The general station in Kaliro regarding sexual gender-based violence and domestic violence in general is at 89%, and the cases reported range from neglecting to provide necessities. We have family land disputes, defilement. We have issues of denial of conjugal rights. Last year we had 315 cases reported in Kaliro District. Yeah, with the creation of awareness, these people are able to report cases to Probation and Social Welfare Office. We refer cases to Child and Family Protection Unit. They also refer to Probation Office. And then we have the Magistrates Court. We have community activists. We have the parasocial workers, the ones who are trained in child protection. They counsel. But then the issue of interpreting, where the magistrate is communicating to the PWDs, you find that there is no sign language interpreter. We have always urged that there should be those people in court, so that communication is eased people with disabilities. As the probation office, we recommend the communities to ensure that they treat these people as part of the community, because some of them, they think PWD, they are not worth a living, and we recommend that they report cases, probation office, police, even these lower structures like LC, you can begin from there. Then we have the community development officers per se at the sub-county level. Yeah, so we recommend that they should not keep quiet. In case of any problem, to meet the probation officer, to meet the district community development officer.
Yeah, thank you so much. Harriet Atiwa, the district community development officer. Generally, SGBV in Kaliro is mainly reported by women, that implying that most of the clients we receive here, these are women who have been sexually harassed, who have been denied resources, who have been all sorts of things under SGBV. But when you look at the data which comes in, you find that there are particular sub-counties which register high numbers. Like we have Namugongo, we've registered, I think, the biggest number, Kasokwe, Nawaikoke, and then Bulumba, Town Council, and Bumanya. Those sub-counties are really hit so much. In violence against women and girls, basically I would look at continuous sensitization people to get to know what exactly it is. Then also continuous sensitization in terms of maybe radio talk shows to reach out to people so that we tell them they have the right to report. Also to deal with those cultural practices. You know, most of them, they don't report, they suffer out there without reporting just because they fear culturally how will the woman really go and report. If you report, you are taken as actually like an outcast in society. So what we have to do is to ensure we continuously sensitize the community on the dangers of GBV. Because if somebody really got to know the dangers of GBV, that if at all I just keep quiet, maybe it will affect me in the future. Automatically they will report. Then the other thing, I would also look at strengthening referral pathway, so that if somebody has a case, maybe the probation officer that have reported to him, we need to know what other services are available and what other people are willing to work with us. So that if somebody has a particular issue that somebody can't handle, maybe you refer to police, you can refer to some CSOs, because we have a number of CSOs here that are working on what? On GBV issues. We have the other structures in communities. Now, like the community activists, we have the paralegals, all those people. If we can really strengthen the referral pathway in terms of GBV response, I think it can work. But also, we have also to look at having role models, something to do with that, so that people can come out and really share what exactly, or survivors, I may not really call them role models, but survivors of GBVs, so that they can really come and share, and other people will be able to open up. You know, the issue of SGBV, it's mainly, it affects somebody socially. Despite the fact that they're also affecting other aspects, but socially. So somebody doesn't want really to lose integrity in community, in society, things of that kind. So we need really to ensure that we continuously sensitize people. Yeah. Okay. Then also coordination, like maybe having those quarterly review meetings like we have, and maybe we bring various stakeholders on board, including those of Ediwa, Uda, those CSOs that are implementing, and maybe we share, and maybe we come also.
Mzee Kirumba Eric, Nkola Nikodak, Kaliro, Orphan, Elderly, Disability and Health Concern, that is Kodak, nga body member. Era tuli mu Kaliro muno, twaba ni muluuka, era tugezaako n'okunoonya abantu abali ku bukosefu mu byalo twabakobera eidembe lyaibwe babanga batuusiza okubatulugunya. Ensonga eyindi, era bwe tubanga tuli kukola ensonga eyo nga tuli kujja okukobera abantu ebyo, tulina engeri yetubayambamu okuba wa referrals, nti mwida kuva wano wabanga wali bubaamu alaba mutuusisa ku buzibu nga for example okumurepinga, tumuwa referral, yeyongerayo yafuna obuyambi. Tugemagana ne ba stakeholders mu district ediri mu program dino, era nga tukolera wala nidiwa abatuukibwako okubakosa mu mbeera ey'okuba nga babakasabanya, but awandi okuyida okukoba nti oba ono yantuusisaako obuzibu oti ne buno. Kale sometimes yawo information yabanga eri kukosa abantu bano. Experience eyindi nti awandi baba bagiire mu bifo nga for example nga health centers, babeindi nala tibenda kubafwa, kutibenda kubakolako olususu nga bwe mwidi nti abantu bakoba nti abantu bana baliko abolususu olweru ati babulabu bule. Kale abantu abandi batya ate bona baba mu feeling ekoba nti abantu batwenda ino kuba waliwo abakobambu ofune envire da abantu bano oba ofune kyabugayiga. So bona babanga kabiri batyo okwewaina abantu, ekyo kyabanga kiri kubaleetera obuzibu. Ayiwe tugire nga tubasomesa, twagezaako okubawa tips era bategeera nti wabanga waliwo obuzibu basobole okuripotinga ensonga dino mu bantu abavunaanyizibwa nga for example ku LC oba ku poliisi n'abantu oba ku masomero nga kankobe nti mwana musomi wabanga eriyo balina bali mutulugunya nti asobola okujja yaripotinga mu basomesa bamukobera ekyokola. Ekitulugunya eryo natusobola okutaawo oba nga bylaws nga ku magombola twakoba nti bwe tunaabona nga atulugunya omuntu aliko obukosefu tujja kumuwanga ekibonerezo kino.
I'm Kahara Irene, but known as Mama Police in Kaliro. I'm working as the second in charge here.
What services are available at Kaliro Police Station for women and girls with disabilities who are survivors of sexual gender-based violence?
Okay, the services we offer at police here, we do register criminal cases, we do apprehend of offenders, we protect their lives, we refer some cases like if it is physical, we refer to medical for treatment. Other cases, when it is minor, we can refer to probation officer, CDO, and other stakeholders.
Okay, specific services we render to those victims. We do counseling and guide them. Then sometimes we refer them to stakeholders like LCs, probation officers, CDOs, medical personnel, from home. Sometimes advise from home.
Okay, thank you. Mama Police, what challenges do you encounter while offering services to women and girls with disabilities?
The challenge which I get sometimes is counseling room, because they need privacy. But I don't have a private room. Another thing, sometimes it can be maybe a father has offended her, but the shelter or a center for keeping her, I don't have. So I have those challenges.
We lack a facilitation of the transport to reach far places. We have got a few police female surgeons, whereby these surgeons assist to examine these victims. Because whenever you take a victim, especially in defilement cases, before a man is examined, sometimes they shine away. So we would wish at least to have those female surgeons who would be examining our victims. Yes.
What have you done to overcome some of these challenges that you've highlighted?
We have done community policing and sensitization. We teach them law. Yeah.
Like the general public? Or?
General public. Okay. Sometimes we visit schools, institutions, and homes. We network with the NGOs, with the other stakeholders, so that they reach down there where we cannot reach. Okay, the advice I give to the community is they should not fear police. They should always report to police those cases. And when they report police, they should open up and tell us exactly. Sometimes they hide, they shy away and fail to tell us, to give us the good information about the truth about the information. Also, after reporting, they should follow up those cases up to the end. If we refer them to probation, let them go there. If we refer them to court, let them go to court. Yes.
I'm Kagwa Hajira, the program coordinator of Women with Albinism Association based in the Lango District. My experience, it is at a high level Why? Because there is high level of discrimination, intimidation, and marginalization of women and girls with albinism. So, if you are at that level, to that extent, automatically you are in fear in most cases. So when you are in fear, many things can go wrong and can happen on you at any time. Like, for example, here we have the perpetrators, and they are not far from us. So at any time they can come in using that chance of we being in a fear. They have a mindset that if they play sex, share with women and girls with albinism, they can get cured of AIDS. These actions come when we are not ready. It's not a choice, it's a chance to the side of women with albinism. Women and girls with disabilities who are survivors of SGBV, they are highly discriminated. And when you are discriminated, information can come and when you are not aware. If you are aware, it comes late, so you can't access. These discriminated women and girls with disabilities, they depend on others. And when you are not self-reliant, you depend on others like guardians, caretakers.
Okay.
At times, they are illiterate. So illiteracy also can cause a person not to access the services. So with LOCs, or for example, I'm a married woman. I've been tortured by my husband. When I go to the LOC, reaching there, I submit in my case. But after coming back, the community people will tell, hey, you were a lame woman, even if the husband helped you to marry you, now you are reporting him, how are you going, where are you going to stay? So they make you fear, and when they tell you that you come back and we solve the issue, you don't go back. Because you are in fear, the man might divorce you from marriage. So you remain there. You stop seeking service from the LOCs.
My name is Elizabeth Kayanga. I'm the founding executive director of Integrated Disabled Women Activities. IDWA is leading a mid-level coalition project together with Women with Albinism, which is a sub-regional organization, and Kaliro Orphans, Elderly, Disability and Health Concern. IDWA is the lead agency of this coalition. It is a 2-year project seeking to end violence against women and girls with disabilities and strengthening institutional response to COVID-19 and other crises that come about. Today we are talking about violence. What does violence look like? Violence happens when women and girls with disabilities are sexually assaulted, they are raped, they are impregnated by mostly their relatives and other members in the community. Unfortunately, families always cover up for the perpetrators, and the women and girls with disabilities are denied justice. Violence also comes into play when we see anecdotal beliefs and unhelpful norms that perpetuate violence against women and girls with disabilities. For example, there is a tendency in our communities where people think that if a man has sexual intercourse with a woman with albinism, they get cured of diseases, including HIV/AIDS. So you realize that the women with albinism are followed by men that are suffering from all kinds of diseases. And this exposes them to unwanted pregnancies and sexually transmitted infections, including HIV/AIDS. Violence also comes into play when young girls with disabilities are denied an opportunity to have education and health services. What are the outcomes that we are looking at with this project? This project seeks to empower women and girls with disabilities to appreciate their rights, go out and engage authorities on their rightful inclusion in service planning. The project also seeks to ensure that government services, especially services that respond to the impacts of COVID-19 among the population, are disability inclusive. The project also seeks to strengthen the coalition partners, that is IDIWA, Women with Albinism, and CODAC, to be in a position to effectively respond to the impacts of COVID-19 among women and girls with disabilities, but also continue to promote ending violence against women and girls with disabilities. What are we seeing so far? On a positive note, we are increasingly seeing Kaliro District local government making steps to provide disability inclusive services. For example, there are a number of gender-based violence service centers, more importantly the health facilities. We are seeing access ramps being erected. The district local government has included in their budget a provision for procurement of 14 accessible labor beds for women. We are also seeing women and girls with disabilities themselves being able to engage and articulate their issues. For example, we have a number of girls that have benefited from the project that were able to report a case where they were denied access to the government program, that is the parish development model. It takes some level of capacity for somebody to be able to do that. In Kaliro District still, the police is carrying out monthly community engagements to sensitize the population about the dangers and effects of gender-based violence. We are also aware that the Magistrates Court in Kaliro has created a desk for special needs. The desk is going to be very helpful into addressing the special needs of people with disabilities who present cases. However, we note that the desk is still lacking sign language interpretation services, but that's something that we can pursue. Yeah, we are also seeing our paralegals, trained paralegals and peer educators reaching out to their peers. They are acting as focal persons for other women and girls with disabilities, helping them to seek services in the health centers. But they are also sensitizing communities about human rights and the effects of gender-based violence against women and girls with disabilities. We are seeing a lot of commitment from families and community members. They now appreciate their role in reporting cases of gender-based violence, but they are also making steps to fight discrimination against women and girls in their households and communities. What recommendations do we have? We recommend that government should take serious steps to bring perpetrators to book. Perpetrators of violence, as earlier indicated, they are family members, they are community members, but oftentimes we realize that women and girls with disabilities are not getting justice as their parents choose to look at these cases, to address cases outside court. This should not happen anymore. We also recommend that government should generate data, real data, gender desegregated data, to aid our planning and advocacy efforts. Government should also be a beneficiary of this kind of data, because that is how they will come up with impactful policies and programs for the people. We also encourage, appeal to government to implement proactive policies. For example, the Building Control Act of 2013 is a very good law. If implemented, it will help government and other stakeholders to deal with the challenges of accessibility to the built environment and communication for people with disabilities. Yeah, we also call upon government to promote participation and involvement of women and girls with disabilities in policy development and program planning, especially the gender-based violence program planning under the Ministry of Gender and Social Development. We appeal to government and any other development actors to mainstream disability in their programming. This will enable women and girls with disabilities to benefit from government programs and those that are provided by other development agencies. Yeah, in conclusion, I wish to appreciate the district local government teams, the political and technical staffs for the support and collaboration for the entire period that we have implemented this project. I also want to thank our donor, that is the Disability Rights Fund and Disability Rights Advocacy Fund, for the technical and financial support, without which the achievements that we are celebrating today would not be possible.